Hi everyone, today is World Diabetes Day. Now, this is a day that has been set aside in order to talk about and create awareness about the disease called diabetes. Now, we all know what diabetes is, but if you do not know what diabetes is, it is basically a condition in which the blood sugar levels are actually higher than the normal. Normal should be somewhere below 100 at fasting blood level. Now, when the blood sugar levels are actually above this, it can be classified as diabetes. Now, we all know that there are different forms of diabetes. We have one, the pre-diabetes. Pre-diabetes is actually when the blood sugar levels are not so high to be classified as type 1, type 2 diabetes, but they are quite high that they can be classified above normal. Now, this is usually from 100 to 125. This range can be classified as pre-diabetes. Then we have the gestational diabetes. Gestational diabetes is the type of diabetes that presents when one is pregnant. That is why it's called gestational diabetes. Sometimes it can resolve when one has given birth. Other times it may not resolve and may actually continue to become type 2 diabetes. Then we have the type 1 diabetes. Type 1 diabetes is actually a genetic form of diabetes. It is the form of the disease in which the body is actually not producing enough insulin to metabolize the sugar that is in it. This is because of a genetic composition of the individual. Usually, these patients actually use insulin to actually regulate the amount of sugar in their system. Type 1 diabetes is the type of diabetes in which insulin is usually prescribed. Then we have the type 2 diabetes. Type 2 diabetes is actually the form of diabetes that is usually not genetic, and in this it's actually maybe due to the body producing enough insulin, but the sugar levels in the body are actually not responding to the insulin that is present in the body. And so this type of diabetes actually is something that develops over time. One of the major differences between type 1 and type 2 diabetes is that type 1 diabetes can occur in any life. It can occur in childhood, it can occur in adolescents and young adults. Type 2 diabetes has a late onset, that is, it occurs later in life. It doesn't occur in young adults. It is very, very rare to see type 2 diabetes in a young adult. That is the basic difference between these two forms of diabetes. Another difference is that pre-diabetes can become type 2 diabetes and not a type 1 diabetes. So if you're someone at the moment you're presenting as a pre-diabetic patient, it is actually advisable that you take care of yourself and ensure that it doesn't become type 2 diabetes. Now, these are the forms of diabetes. Now we're going to go into the care. How do you actually prevent or reverse pre-diabetes, or to manage the diabetes when it has already started, when the onset has already started? Number one is your dietary modifications. If you can go through my past videos, you will see some of the dietary modifications that I have talked about in the past. It is very important that if you are a pre-diabetic patient or already a diabetic patient, that you actually take time to monitor your diet, because most times it is what you feed the body that it actually gives you back. Apart from the drugs that you are taking, it is important that the food you are taking also corresponds and helps your body in order to respond to what is going on in it. Then number two thing is to ensure that you eat what is needed. Most people actually advise that you do a keto diet. I do not really advise a keto diet, because most times hypoglycemia can set in people who do keto diets. You do not have to cancel out carbohydrates completely from your food, because your body still needs glucose in order to function. Rather, you have to eat carbohydrates in a certain ratio in order to ensure that it do not spike above the normal, but it actually gives you enough strength to take you through your day. That is why I always advise for a healthy diet. Most times it is advised that you do a plate ratio. You divide your plate into 4 and you do 1/4 of carbohydrates, 2/4 of protein, and 1/4 of fats and veggies. This is very, very advisable and has been proven to work by a lot of researchers. You can also speak to your nutritionist in order to see what can work for you best. Another thing is your medications. Most people who feel like at the moment my blood sugar level has come down, it is below 100, they do not take their drugs for a long period of time, and then they come back with a much higher results than what it used to be when they were consistent on their drugs. It is not advisable to actually skip most of your drugs before you stop or skip your drugs. It's advisable to see your healthcare giver and speak to them about it. Then get the best professional care that you can at the moment. If you are someone that is type 1 diabetic, it is very important that you wear your tags and you actually inform your family members about what is going on, because it is a kind of stuff that when there is an emergency, you need an insulin injection and it should be administered as quickly as possible. Also, if you can have your pens with you, it is very, very important. Apart from the dietary modifications and taking your medication, it is important that you have a daily exercise routine, or you actually have a daily work-life balance. Because if all you do in a day is sit at work, because most of us nowadays we sit and work, if all you do all day is to sit and work, it may get to a point where your body is not exercised and you are not able to metabolize the sugar that is in your body, and the body cannot metabolize what it doesn't need. Most times you see yourself that sugar just stays dormant in your body. It is advisable that you actually get exercise day to day. At least 30 minutes walking exercise can actually go a long way to actually do a lot in your system. Apart from exercise, another thing that is advised is that you stay hydrated. Yes, how does hydration relate to diabetes? A lot of things can actually happen when you are dehydrated, and we know that diabetes is something that has to do with a lot of tests. One of the symptoms of diabetes is increased tests. It is advisable that you stay hydrated so that your body is actually regulated, everything in the body works well. If someone has been diagnosed as a diabetic or a pre-diabetic, it is very important that you manage your stress, both your emotional stress, your physical stress, and all forms of stress, because with stress comes a lot of other things. Now, another thing you should do is to get enough sleep. Like I usually say, sleep is actually a period where your body repairs itself and actually does the healings that it needs to do. If you're not getting enough sleep, please try to incorporate that into your daily routine. Another thing you should do is to eat nourishing foods. Apart from normal food that you eat every day, you have to make a food diet where you eat fruits and things that can nourish your body. Get a supplement regimen. There are supplements that are very good for lowering your blood sugar and to manage diabetes. Please get that. If you need any coaching on this, you can send me a direct message and I will be very, very glad to answer. Apart from all this, it's a good healthcare professional that you can speak to and who you are open to. Have a lovely day and take care of yourself. Bye. Send this video to anybody that you know who is a pre-diabetic or a diabetic or who has a history of diabetes in their family. Bye guys.